Hi, I'm Dr. Schuft-Helland, and I'm making this video to help you understand more about the coronavirus. Now, the coronavirus is the name of a germ that's going around right now. And like a lot of other germs, this is spread because mostly people that are sick with it cough, and the germ goes into the air, and sometimes it goes onto other surfaces, and then another person who's not infected gets the germ from breathing in the coughed germ in a little tiny droplet of water, or sometimes if the germ is sitting on a door handle or something that you might touch, you can also get the germ in that way. Like a lot of germs, the main thing you can do to try not to get infected by this germ is the same thing that you do for a lot of different germs, is that you have to make sure you wash your hands, probably more than you already do. The coronavirus is a new germ that hasn't really ever been around before, but it's really similar to a couple other germs. One is like what we call the common colds. So sometimes when you get stuffy nose or a sore throat and a little cough, and maybe you're only sick for a couple days, it's actually very similar to that. Or influenza is another really common germ that a lot of us probably had over the course of this winter already. Maybe you or maybe some of your classmates had to stay home for a couple days because you had a fever and a cough, and usually after about a week or even less, you felt pretty normal again. Well, that's a lot what this germ acts like for most people, especially young kids. Young kids tend not to get very sick from this germ. Young kids usually only have those cough and sore throat and fever sort of things for just a few days, and they don't even get that sick. The problem is that this coronavirus germ is causing the older people around us to get much more sick and sometimes even need to go to the hospital. And so what we're really trying to do is we're going to try to prevent all the older people, like our grandmas and grandpas, from getting an illness from this germ. Because if they do, it can be much more severe. So that's why we're starting to limit a lot of things. For instance, we're going to be closing a lot of schools. We're going to be canceling a lot of otherwise fun things like basketball and soccer games and state championships and things like that. And we're going to try to stay home so we don't spread this germ around quite so fast to each other. So the main thing to know about this is that if you get this illness, most of you will not be very sick. Most of you will get better pretty quickly on your own, and you won't even need to see a doctor, and you won't even need any medicine, because this is a type of illness that does not require any medical treatment for most people. You just have to wait at home until you get better. But with a lot of new illnesses and new things in general, sometimes these things are scary. So there's a lot of people that are a little nervous about this, and it's okay to be nervous, especially, and scared a little bit, especially with things that are unknown and things that are unfamiliar. But the main thing to know is that there's going to be people in your life, like your parents and older brothers and sisters and doctors and nurses, that are going to help take care of you, and you might not even get sick from this. A lot of us probably won't even get sick from this illness, and it's just something that we've got to work through and be patient with while we wait for the illness to pass through. If you have questions about these things, make sure you ask your parents or a doctor or a nurse or somebody like a teacher that can help you understand more what's going on. Thanks, guys.